Hello, everyone, and welcome to Neurocracy. Today, we're joined by Dr. Philip Cheng, a clinical psychologist who serves as an associate professor of medicine in the Department of Sleep Medicine at Henry Ford Health, and an adjunct research associate professor at the University of Michigan, and the director of the Center for Behavioral Circadian Medicine. His award-winning research translates circadian science into practical and accessible innovations, and he tackles challenges from shift work disorder to disparities in sleep health caused by racial discrimination. Dr. Cheng's work spans digital behavioral treatments, the role of sleep and stress regulations, and the intersection of sleep quality and mental health. Dr. Cheng, thank you for joining me today.
Thanks for having me.
So, my first question is, what are the most promising strategies you found for helping people whose schedules are at odds with their biological clocks?
Yeah, that's a great question. I would say that based on the evidence, the most promising strategies are really fatigue risk management, right? Like
Okay.
making sure that people are getting as much sleep as they can. Now, my research has really focused on the discrepancy between that approach and what we understand to be the underlying cause of people who work at night and struggle with sleep, which is something called circadian misalignment. So that just means that the work schedule is happening at a time when our body is expecting to sleep, and therefore down-regulating processes that support alertness and up-regulating things that or processes that support sleep. And so my research has really focused on how can we reduce that circadian misalignment and really getting at the root cause of the challenges that people who work at night experience.
Okay. So I know a lot of your work connects circadian science to mental health, right? Especially major depressive disorder. And I'm just curious, how does improving sleep quality influence depression symptoms? And are there certain circadian adjustments that have a much larger impact on mental health than others?
Yeah, that's a great question. So if you've talked to anybody who have sleep problems, it's a miserable time. It
Right.
just
Yeah.
is terrible to feel like you don't have sort of your faculties about with you. And, some people will say that like they feel like a different person. In fact, if you talk to night shift workers, one of the qualitative papers that we have really sort of saw that night shift nurses felt like they weren't themselves. They were doing things like yelling at their kids or feeling irritable in a way that's so chronic that it started to impact their most cherished relationships, right? And
Wow.
that in some ways sort of feels a little like a personality change. And
Right.
and if you feel like there's no escaping that, certainly you can feel depressed, right? That would be a
Right.
very logical
Okay.
outcome to those kinds of circumstances.
Yeah.
And another line of my research is really looking at, well, what happens when people come out of that space? If we can fix their sleep, help them feel more like themselves, are we just removing an obstacle or are we doing something more than that? And so far, our results seem to suggest that we're not just removing a problem, we're really helping people develop resilience, that they
Mm.
not only can come out of like a low point of their life, but we can actually prevent people from falling back down into, other low points of their life.
Wow. That's powerful. So, especially as a high schooler, I think we can both agree that there is some sort of misalignment between early high school start times, especially before 8:30, and the shift in circadian rhythms, the 2-hour delay roughly in teenagers. And I'm just curious, do you also observe this in teenagers at a different or similar level in terms of the impact of sleep problems on mental health?
Yeah, the most poignant way to think about this, or that at least I think about this, is in a disorder called narcolepsy.
Okay.
So this is where you have excessive sleepiness, not necessarily because of circadian misalignment, but because of an underlying neurological condition. And what we see is that this sort of heartbreaking cascading effect where let's say you are having trouble staying awake in class and now you're not learning, right? So now your grades are suffering.
Interesting. Yeah.
And if you're suffering to the point where maybe you're flunking out of school, that becomes a problem, right? That severely limits your career prospects. And so maybe instead of going into a corporate career, maybe you have to work something that's more sort of manual labor, let's say. But just because you go into that space does not necessarily mean that you are able to function, right? So maybe now you're still struggling with sleep and you can't show up to work on time. And so now what's happening is you can't hold down a job.
Right.
And so not only can you imagine that you have someone who is struggling to establish mastery in their lives, which we know is important for mental health, they also have to deal with making ends meet. And that's a big stressor,
Yeah.
right? Especially with rising costs. And again, if you think about these circumstances, you can very easily imagine why someone in those circumstances could develop something like depression.
Yeah. So you studied how racial discrimination contributes to sleep, right? And
Yes.
especially with teenagers, I've looked into this too, and I've noticed that sometimes there's a little bit of a disparity in the effects of early high school start times, especially among teenagers of lower socioeconomic status. So I'm just curious, what are some of the other systemic issues that contribute to sleep disparities that you've observed?
Yeah, I think a thing that's happening in the science, sort of within the last decade is that we've started to get wise to the fact that racism isn't just like racial social discrimination,
Right,
but it's really systemic, meaning that there are policies or
right,
environment. If you think about like redlining, really sort of neighborhoods that are well resources versus not, and how the racial distribution in our country works in terms of those neighborhoods. There are just the reality is there are groups of people who have been marginalized into neighborhoods with less resources. And that could look a bunch of different ways. It could be access to green spaces. It could be access to a market with fresh foods that, of course, affects your diet.
yeah,
It could be access to infrastructure for safety. And that also can lead to sleep problems if you are, worried about crime, for example. And all of these things are additive, right? So if on top of that you are also phase delayed and you're having trouble waking
yeah,
up, now it's
yeah.
not just a sleep problem. It's a sleep problem on top of a nutrition problem, and all of those things kind of come together to reduce the likelihood that you can achieve success in school that really requires you to pay attention and to, learn and just learn instead of worrying about learning and your safety.
Okay. So this is more of a fun question, but if you had the ability to implement one change or policy at Henry Ford Hospital to improve staff or patients' alignment with their circadian rhythms, what's one thing that you would change?
And this is something we've started to work on, but
Okay.
for a while now, I have really been trying to get Henry Ford Health to include sleep education, and circadian rhythms into orientation processes for our night shift nurses, and
Okay.
and we're now working with the graduate nurse residency program where we are telling them about sleep and circadian
Yeah.
rhythms. We hope to do more, but that's really one, we'll say simple, not necessarily easy, but simple change that could have a big impact for our night shift workforce.
Interesting. That was a very well thought out answer. Sometimes when I ask that question, people are caught off guard, but I think it's great to hear that you're actually actively responding to that question before I even asked it. So that's amazing. So you've earned numerous awards for both your research excellence and student mentorship. And in your view, what's the most important thing to teach or instill in the next generation of sleep scientists?
Ooh, that's a really good question too. I would say that a big piece of especially aspiring academics, but I'm sure this does not just re revolve around academics, but this idea of persistence, sometimes psychologists will call it grit.
Okay. Yeah.
But the commitment to doing something that is hard and not shying away from, you know, doing everything you can to get better at the thing that you want to do, even in the face of failure, and really sort of developing the maturity, the insight to be able to take failure as not an indictment of your capacity or your worth, but really as opportunities to learn and to get better.
Yeah. That's a powerful answer. And I might be taking a stab at the air here, but it sounds like you have a specific story of grit, maybe. Would you be able to share any particular stories throughout your research or just your journey in general where your grit helped you overcome obstacles?
Yeah, that's a you have a lot of great
Oh,
questions.
thank you.
I have a story that really I think illustrates what grit might actually be as opposed to what we think it is.
Okay.
So I think a lot of us think about grit as this like inherent trait about like how persistent you are, how hardy you are, and how maybe stubbornness it may go with that. And I have to say, my first grant that I wrote did not get discussed, which means it didn't have a chance of getting funded.
Okay.
And as a young scientist, that was disappointing to say the least. And I had to turn around and write a new grant. And well, actually, what happened was I collected more data
Okay.
to try and resubmit because you get two tries with a
Okay.
grant, and so you can address some of the comments. And when I collected more data, all of my effects went away, which is doubly disappointing because it basically confirmed to me that the initial idea had actually was not the right idea, right? That the
Okay.
data actually shows that that's probably not an effect that's real. So I had to turn around and come up with a new idea. And I was a postdoc at this time and was very aware that my funding was about to run out at some point if I didn't have success getting my own funding. And I remember writing this second grant in a space where I was pretty anxious and like a little bit depressed because it was a lot of pressure to be like if I don't do this right, I'll be out of a job, right? Um, and I went on the job market for a little bit to try and see if I can at least secure some alternative options. And I will say that was a time where I could have quit. I could have said, this is too stressful. And let me just find something else to do. And the reason why I persisted wasn't because I was some like hardy, stubborn, persistent person, but it was really the idea that if I quit this work, I wouldn't have the opportunity to see my friends, my colleagues at the annual sleep meeting that we all go to. And like that made me sad. Like I wanted to see my friends.
Wow.
I wanted to be able to talk about cool ideas. And it was in those moments where I said to myself, okay, like I'm willing to sort of struggle through this just a little longer for the potential ability for me to be able to still sort of be in community with the people that I like and care about. And that's not a story about how strong I was as a person, in terms of my, my grittiness. It was a story about how community is so important to our well-being and a value that we should cultivate, and emphasize in our training.
Oh, that was a beautiful story, and that's very inspiring to hear. I can hear the passion for your work and what you do just in your voice, like, as you told that story. So thank you for sharing that.
Of
I'm
course,
so
yeah.
glad I asked you if you had something to share, or else I wouldn't have heard that. But looking ahead into the future, what emerging technologies or research areas in circadian medicine excite you, and what are you looking forward to in the next 5 to 10 years in sleep science?
Yeah, what I'm especially in the circadian science space, I am very excited to see what kinds of assessments that are scalable and feasible in the real
Okay.
world. Because one of the big problems in circadian medicine is we do not have real world tools to address the problems that we're seeing. The
Right.
analogy I always go to is it's as if we have this problem of hypertension, but we haven't yet invented the blood pressure cuff. And we're trying to treat blood pressure without a measure of blood pressure. Like, how crazy is that,
Right.
right?
Right.
And so we have circadian rhythms. We know they exist. We know people have circadian problems, but we don't have a measure of the circadian clock that is feasible in the clinic. So that's been a big part of my research program. I'm not certainly not the only one who's working on this. So I'm very excited to see what the community comes up with in terms of
Yeah.
solutions.
So I wanted to ask, are you working on the time signature at all?
Time signature is not part of my own work, but I am collaborating with the folks
Cool.
at Northwestern
That's super cool. Yeah.
to work on
Yeah.
time
I came
signature.
across it as I was doing my own research on what's going on in the sleep world, and I think it's super cool. Could you maybe like explain a little bit from your perspective on what it does and maybe
Yeah.
the stuff it needs to do in the future for it to be used?
Yeah, no, I think the time signature stuff is really interesting.
Yeah, they sound
So here's my metaphor. You can think about if you did not know if clocks didn't exist, for example, and you needed a way to tell time. Well, we know there's a sundial, but another version of a sundial is you could plant in a garden enough variety of flowers where if you knew some flowers opened up in the morning and some flowers opened up in the afternoon and some opened up at night, and you also knew that some flowers opened up in the morning and stayed open until nighttime, you could, with enough flowers in the garden, infer what time of the day it is by looking at which flowers are open and which flowers are closed.
right.
And that's sort of the idea behind
Okay.
this is a simplified version,
Right,
but it's
right.
kind of the idea is if you look at instead of flowers, it's
Like proteins or
gene expression, right?
right,
If
yeah.
you knew that some genes got expressed at certain times of the day and others were down-regulated at certain times of the day, and you had enough information to tell at any time point which genes were being expressed and which genes were not, in theory, you might be able to tell what time of day it is.
Okay. That's a great metaphor, by the way. That yeah. I did know it had something to do with like measuring the genes, but I guess I never really considered how each gene has its own kind of like maybe circadian rhythm. So that like different plants having different like times of like when they flower. That's really
Yeah,
good.
yeah. Because
Yeah.
if you had a flower that opened every 4 hours, right? You could
Right.
tell, you can count, right? If you watched how many times it
Yeah.
opened, you could tell in theory how many hours it's been since
Yeah.
sunrise, right?
Yeah. So on that futuristic note, I'd like to thank you for joining me on this interview today. I think we had a great conversation, and I'm so glad you got to share some of those stories that hopefully inspire the next generation of sleep scientists, and that could be me one day, hopefully.
That would
And
be very cool.
yeah, and I'm really glad you were able to speak about your passion and the work you're doing. So thank you.
Yeah, thanks for thinking of me. This was great.
Yeah.